While the COVID-19 pandemic has brought most of the world to its knees, it is often forgotten that there are other major health crises going on at the same time. Tens of thousands of children around the world continue to die of another extremely infectious disease that rarely makes headlines: measles. In 2018, measles claimed the lives of more than 140,000 people, mostly children around the world, and the numbers for this year are expected to be far higher following devastating large outbreaks in several countries. 3 countries in Sub-Saharan Africa, Chad, Central African Republic, and the Democratic Republic of Congo are currently struggling to contain the deadly measles epidemic. When I joined via Skype by Doctors Without Borders Southern Africa Human Resources Senior Advisor James Kambaki. Sir, thank you so very much for joining us here on SABC News SA Today.
Thank you for inviting us.
When so much focus or attention right now the world over really is on coronavirus, how do we remind people, and particularly in the medical fraternity and media, to also bear in mind that there's still other diseases to, pay attention to and to worry about, as is the case now with measles?
Yeah, the figures are just staggering high. If we actually take note of the deaths that has occurred in 2018 of measles is 140,000. The countries like DRC, Central Africa, and Chad are really badly hit by an epidemic of measles. Yet, of course, it does not reach the headlines. There's a lot of work that needs to happen in those particular countries, because measles, if all know, is actually a preventable disease. Yet it's so difficult to actually intervene in those countries because of course, infrastructure and the logistical magnitude that actually is needed to vaccinate so many children. So measles is and other diseases, as soon as COVID-19 has come in, other diseases have not stopped affecting us. There's still malaria, there's still malnutrition that is still affecting us. And so we, as Doctors Without Borders, we're trying to raise the plight of many of our patients who are affected, and just put the focus back to the situations that other diseases are still killing people, and we should not actually stop or deviate from the progress that you have made so far.
Clearly, the fact that measles response seems to have been neglected at this point can't really be, we can't put sufficient blame on anyone really, because of the fact that we have this COVID-19 virus that we're all the world over struggling with and dealing with at the moment. So what exactly should be said then in terms of addressing these other issues and diseases? Because we can't really say anyone in particular is to blame. We know that the organization you represent, MSF at the moment, has had to kind of split themselves in order to address other issues where the focus might have been on measles or malaria. We now have another virus or disease that has now been brought into the picture. So what do we do? How do we navigate this situation? There are just so many health workers that are available.
Yes, and we know that there's also challenges that came with COVID-19. Movement, for one, is really hampered by COVID-19. So we cannot easily move human resources, and we cannot easily move medical supplies to different countries the way we used to before. So these are the things that we actually put up there, that yes, there is COVID-19 that is making it much more harder to intervene in usually disease-stricken countries, and we should still maintain to have those focus. For countries like Central Africa, we expect possibilities that in the coming period, where we are actually targeting to vaccinate about 340,000 children between the ages of 6 months to 10 years, that such priorities may be interfered with. And that's why we are asking that it should not possibly be stopped or redirected, or funds or human resources should not only be redirected to COVID-19, but we still need to keep momentum of vaccinating those children. In DRC, in 2019, we managed to vaccinate about 860,000 people, but it's not only vaccination; it's also treatment of patients. Only in 2020, about 17,500 patients we've cared for in our facilities in DRC. 600 patients have also died, and we know that it's an intense work that is required. So we want to keep focus that there is these other diseases that are equally deadly that we need to continue actually like fighting against.
How are your teams, how are MSF teams coping or dealing rather with this new focus? And I suppose that would mean a shift of resources that have now been been going to the COVID-19 crisis. How have your teams that are stationed in all parts of Africa been sort of coping with all these pandemics?
It has been hard for our staff. Because of intensity of work, we've actually kept a rotation of staff, possibly every 6 months or even less. But now most of them have to actually extend and work longer in the field because there are no free movement to either go back, and so they have to actually work harder to stay on ground and to intervene in COVID as well as normal health programs. At the same time, we cannot bring in new staff to actually support. Our national staff who are within our beneficiaries are also affected by COVID-19 together with malaria, together with malnutrition. And so it's really taxing to demand too much from them as much as we continue to actually focus on improving healthcare in those particular countries. So the situation is been exacerbated, a bit difficult by COVID-19. You can just take an example of a situation where you are trying to vaccinate a population, let's say, for example, Chad, where the target is to actually achieve about 95% coverage. So far, the statistics shows that we've only managed 37% because of usual challenges of terrain, harsh temperatures, lack of infrastructure, and now, again, COVID-19 challenges. So you can just see the magnitude of the situation that is not easy for health workers, not only for Doctors Without Borders, but entirely the entire globe. Health workers actually are doing much more now than they would actually have been doing previously.
And just a closing question, I know it's a bit of a side note, sort of issue, but MSF has been involved in conflict areas where there's a lot of sort of war-torn regions and so forth. And I suppose it might come across as a silly question, but one would want to ask, those responsible for the conflict, have they sort of stayed back? Are they also observing social distancing at this time? I mean, it would be such a problem to have, COVID-19 on one hand, measles on one hand, on the other hand, and then also bringing in the factor of conflict. Can you paint a picture for us of what's happening in those regions where we know that MSF has sort of been stationed, where we know generally there are conflicts?
Of course, apart from conflict, there's also if you take an example of DRC, where Ebola also was overshadowing measles, because of course Ebola was a big epidemic in Western Africa a few years ago, and when it actually hit DRC, that was the limelight. But measles, since 2018, was actually killing so many children at that particular time. So Ebola came in and actually took limelight, and it was big focus was possibly on Ebola than measles. Of course, conflict has never stopped. So it was much harder to intervene during Ebola crisis on those particular regions in DRC where we were intervening, or because of course it's very difficult to actually put that rules to those who are fighting. Sometimes hospitals were looted. Patients with Ebola could actually run away because of conflict. It was a mess. So conflict has not stopped. Insecurity in those areas that we intervene is still there. So we have to navigate also the challenges of insecurity to try as much as possible to intervene in very remote areas like in Central Africa, where there are no other organizations that are working there. Healthcare is not there, does not actually exist. So the health-seeking behavior of the population is not really there. So much more difficult situations for any of the health workers or programs to intervene in this particular context. Yet, of course, we have deaths that could be prevented if only routine immunization could be taking place. If patients could come early to healthcare facilities to be treated and so forth. So it's much more challenges apart from war or conflict that is in those particular contexts.
All right, James Kambaki, thank you so very much for being with us and giving us your input and representing MSF so that we know what is going on in the ground in other parts of Africa. Thank you, sir.